All right. Thank you, sir. Good afternoon. Today is November 15th, 2023, and it is 4:16 p.m. As a quorum of the committee is in attendance, I'd like to call to order the meeting of the Central Health Budget and Finance Committee. Unfortunately, Manager Musaitif was unable to attend this meeting today, so I will be acting as chair. As a reminder, some of our committee members may be also participating by video conference, so the staff will be managing video and audio feeds of all participants closely to make sure we have a legally compliant meeting at all times. First item of business is public communication. Members of the public who wish to make comments virtually during the public communications portion of the meeting must have registered with Central Health via the online form or by telephone no later than 2:30 p.m. today. I've been told and informed that we have no one listed to make comment. We will now proceed to the Budget and Finance Committee agenda. Agenda item number 1, approve the minutes of the October 25th, 2023 Budget and Finance Committee meeting. Dr. Martin moves that the committee approve the minutes of the October 25th, 2023 Budget and Finance Committee meeting, and Manager Valandez seconds. Any further discussion? Hearing none, all in favor? Aye. Any opposed? Any abstaining? Motion passes. Agenda item number 2, receive and discuss the quarterly financial and operational reports for community care health centers and Sendero health plans. Dr. Jason Fournier and Tara Trower will be presenting for community care, and Sharon Alvis and Ellie Parienche will be presenting for Sendero. Jason and Tara, welcome.
It's on. Okay. Good evening, Manager Bell and co-managers. Thank you so much for having us this evening to go ahead and present our quarterly report for the period ending September 30th, 2023. It's our distinct pleasure to be here. As mentioned, I'm Jason Fournier, and joining me this evening is our Chief Strategy Officer at Community Care, Tara Trower. So just some highlights. We know that included in your packet was a full written report with some significant details and activities, and Tara's going to take some time to go ahead and highlight some of the operational and organizational initiatives and priorities that were executed during the last quarter, beginning July 1st, 2023 through September 30th, 2023. But I want to first start by going ahead and indicating, and as included within the packet and the report, that much of the work that we're doing is, of course, driven by the strategic priorities set by our board of directors at Community Care, and it aligns very well, of course, with what your team here at Central Health and you as a board of managers have been working so diligently to achieve, which is greater health equity within the community and strengthening the overall service delivery system. So if we can advance to the next slide, that'd be greatly appreciated. So notably, one of the main objectives that we've had over the last 3 years at Community Care is to increase access to services overall, and to optimize the provision of services. And so for the 12-month period ending, and so for awareness and for those that are viewing online as well, this quarter is our fourth quarter ending, so it actually concludes our fiscal year as of the end of September. And so we did a 12-month run rate compared back to the previous fiscal year, so for FY 21-22, which is October 1st of 2021 through September 30th of 2022, and compared that to the most recently closed fiscal year, which goes from September 1st of 2022 through, October 1st of 2022 through September 30th of 2023. What we noted overall from an unduplicated patient perspective, so these are folks who are coming in for services, they have a face-to-face accountable visit or encounter with a billable provider. That can occur via telemedicine, but of course the vast majority of that is occurring within one of the 29 health centers that we operate in conjunction with Central Health. Last year, for the fiscal year ending, we had 130,532 unique patients served. Comparative to the year before, that's over 3,000 more patients, almost 3,000 more patients served. It also denotes the largest number of patients we've ever served in a 12-month period. So that's quite notable. And that's presented on the right-hand side of this graphic. What you're seeing is quarter-over-quarter, year-over-year trends. And you can see consistently throughout each of the quarters of the last fiscal year, comparative to the coinciding quarter the year before, that we saw both a growth in the number of visits that were provided as well as patients. So as you take a look, you can go ahead and see in the first quarter of what we would see as fiscal year 2022, there were 61,540 patients served. Versus 62,991 for the first quarter of this year. And you take that all the way to the most recent quarter, and you see that there's a significant increase, right? Even compared to last year, from September or October 1st through the end of December of 2022, comparative to the quarter that we're reporting on, which is July 1st through September 30th, it's about 5,000 more unique patients that are served. One of the biggest drivers around that, as presented in our report, our quarterly report to the Board of Managers, is workforce efforts. And those workforce efforts are specifically around clinical support staff and clinicians. And so that's one of the reasons why this consistently quarter over quarter, as well as year over year, is demonstrating significant increase in services, as well as other initiatives. So if we can proceed to the next slide, I'm going to hand it over to Tara, and she's going to talk about some of the key initiatives that we had delivered in quarter four.
Hello, managers. Thank you for having me today. Can everyone hear me all right? I'm a little bit softer speaker than Jason is. So access is clearly one of the themes. It was a theme when we came and spoke to you last quarter, and just sort of highlighting some of what that access looks like underneath for you all in terms of our patient population. The number of visits that Jason just finished describing amounts to about an average of 3.4 visits per patient, which really speaks to the fact that we really want to, and one of our goals is to be their healthcare home and their home of choice. 79% of those individuals were Travis County residents. 97% of them were low income. Our target population under 200% of the federal poverty level for those who reported income. And then about 60% of our patient population is best served in a language other than English. Obviously, Spanish is our highest level of other languages spoken within our patient population, but you also have Farsi, Burmese, and Arabic. I was speaking to your healthcare champions just the other day, and they were surprised that it was no longer Vietnamese, and that's really just a reflection of how our community continues to change. Related to access, in the quarter that we're reporting on, we were very excited to celebrate the opening of our Chalmers Court Health Center. This health center, and I know some of the managers were at the event, is unique in the fact that it is our first health center embedded in a public housing development. There are other urban centers where this is sort of standard practice, and really is a way that we are working to realign and address the changing demographics within Austin. We all know that gentrification has really changed the landscape in East Austin, but that doesn't change the fact that there are pockets of lower income individuals, lower resource, who still need access, convenient access to healthcare. And with the opening of this clinic, it's in partnership with Central Health and with the Housing Authority of the City of Austin. It places us right in the middle of a really beautiful expanded complex that also has meeting spaces, big brothers, big sisters, a number of helps and supports for patient populations, and also pulls from the developments at Santa Rita and Rosewood. Next, and I'm really excited about this one, when I arrived at Community Care about a little more than 2 years ago, we were still reeling from the pandemic, and call centers and wait times was a common theme and a concern. I know it was expressed in the community conversations that you all had in development of the strategic plan. So I'm very happy to report that wait times are at the lowest level since the beginning of the pandemic. The teams have reduced the wait times on calls from around 5 minutes to less than 1 minute. This is a reflection of both the stabilization in hiring. Call centers are hard work to recruit for, as well as an emphasis on finding creative ways to make sure that we have enough Spanish language speakers. That really, because again, I mentioned the language composition of our patient population, handing them off to a third-party translator takes more time and really causes backups and a less desirable experience for many of our patients. So very excited to be able to speak to that progress, and there are more, hopefully, adjustments on the way to help increase the efficiency and effectiveness of our call center. And I should note that reduction is, even though we've had a 23% increase in call volume over that period of time. So really pleased to report on that. The board has also asked both us and our partners at Central Health on appointment wait times, which I'm happy to report that we've successfully decreased the average lead time for scheduling appointments in family medicine and dental services. I will note that we did see a small increase in pediatric from the last quarter, but that is not unexpected given this quarter reflects the beginning of the school year, and during the summers there tends to be more access as people are busy vacationing, and then there is a rush to get those school physicals and vaccinations and well child visits. And so, again, that should be noted as well. Next slide. So, moving on to, you all have heard a lot about value-based care. Community Care's board approved us joining the newly formed Texas Association Community Health Center Clinically Integrated Network. That is a mouthful, and really it's a collaboration with our peer community health centers within Texas to really form collaborative contracting agreements in the value-based healthcare space. Previously, we weren't able to join forces in that way because of antitrust law. This allows us to do some data sharing and other things to really effectively negotiate larger contracts with providers that really incentivize and compensate based on outcomes, which is really a direction that many folks, particularly for a patient population with such complex needs, that paying per visit, per procedure can be less effective than looking at total outcomes. And certainly from the perspective of equity, that's really what we're driving for at the end of the day, is increased outcomes or improved outcomes. And I will just note that sitting next to me, Jason Fournier was elected chairperson of the committee that is pushing that work forward at TAC. So very excited. It's the largest of its kind, led by community health centers in the nation at this time. Additionally, some other initiatives that I will touch on briefly that just sort of reflects, again, the focus that we continue in the space of equity. Community Care was fortunate enough to receive a grant from the Episcopal Health Foundation. It was a multi-part grant. One of the elements was evaluating staff and patients and developing a social justice curriculum for our staff to make them even more aware of the challenges that many of our patients face. That work was completed, and we worked really hard to develop training that wouldn't impact access. Another theme, other sorts of organizations can shut down and take 1 or 2 days to do sort of a full gamut of continuing education. We can't do that because patients still need to be seen, and so it's a really innovative model in short bursts over the course of the year. It's been piloted, and we look forward to fully implementing it in the coming year. And then the last two that I will mention, we have consolidated Ben White Dental Clinic. That was our last freestanding dental clinic. The rest of our dental services, including our expansions, are part of the primary care space integrated healthcare model. Again, demographics, Austin is always changing, and 78704, which is where the Ben White Clinic was housed, only 113 of the patients seen in the last year had that zip code. And given the needs and access at some of our other locations, including Southeast Health and Wellness and South Austin, we felt like we could still serve that patient population and increase our capacity at our other sites. And so that site was decommissioned this fall. And then last but not least, and Jason is going to speak a little bit more about this, we've spoken to you before about the Medicaid redetermination and how we are trying to assist our patient populations through that process. We have partnered with foundation communities as well as with Central Health to reach out. First, we prioritized the cohort of women who no longer had coverage because they were postpartum many years ago during the course of the pandemic. We, in this quarter, switched our focus to really concentrate on pediatrics. I'm sure you all have seen the headlines. While some folks have been removed from the roles correctly, there are a number of others that, for administrative reasons, have fallen off the rolls, and we are working to not only reach out to those individuals, identify and help them through the Medicaid application process, and if they are not eligible, to also screen them and either get them onto MAP or whatever other supports or financial assistance that they might be well qualified for. And Jason's going to talk a little bit more about that and the impact that that issue is having on our service delivery as a whole. Thank you.
Yeah, thanks so much, Tara. As you guys can see, Tara has a very good grasp of all the initiatives. That's partly her role as our Chief Strategy Officer, right? We have the distinct privilege of representing all the efforts that not we're doing, but our teams are doing. And it really is in partnership with you guys here at Central Health. We can't do what we do each and every day without your support and taxpayer support here, Travis County, as well as the support that we receive as a community health center through the federal government and the various different partnerships we have. One thing that we didn't talk a little bit about that I want to hit on before we get to the next slide is that we did, within this last quarter, receive notice from the Centers for Disease Control and Prevention that we were awarded a highly competitive award to go ahead and expand and further develop sexually transmitted infection clinical infrastructure. It's not a grant award, it's known as a collaborative agreement, so there's a difference. A grant usually is, we specify, here's what the scope of work is going to be, they provide the funding, and then there's key deliverables that you get measured on. With the collaborative agreement, this is a 5-year collaborative agreement with the Centers for Disease Control to expand that infrastructure, STI-related infrastructure here within Travis County specifically, and that collaborative agreement then over 5 years, $2.5 million, comes with a relationship with CDC where we actually have a back and forth with them to say, here's what we're thinking. They say, no, you should be thinking about this, or here's some of the best practices. There were 26 awards across the country. If you looked at the awardees, there were only a couple of health centers. The vast majority were actually very large academic medical centers. And so we're very proud of that. More importantly, though, is the fact that it allows us to be able to look at the infrastructure needs within, which means clinical needs, and how we best position our services and expand those services to better support. So the first year will be actually developing that infrastructure plan in collaboration with the Centers for Disease Control and Prevention. And then the subsequent 4 years will be actually implementing that plan with the ability then to renew that funding in collaboration with the CDC. So it's a joint project overall. So an exciting one for us. It's the first time we've ever had a collaborative agreement with the Centers for Disease Control. So if we don't mind advancing to the next slide. So what Tara was outlining relative to the collaborative arrangements and collective efforts we have with community foundations, our foundations community, and with Central Health as it relates to Medicaid redetermination. As you may recall, as part of the public health emergency, COVID-19 public health emergency, there was a core requirement throughout the pandemic that there's continuous Medicaid benefits provided to Medicaid recipients. So by way of background, if we had a prenatal patient back in June of 2020, she was obviously pregnant. Normally what would happen is after that baby was delivered, 6 weeks later, she would have lost her eligibility for Medicaid. Because of the pandemic, that persisted all the way up until May 11th of this year. So that's continuous Medicaid eligibility. As of May 11th, then the state and across the country, Medicaid agencies were allowed to go through a redetermination process. And in this case, the example I gave, that individual was known no longer to be eligible and would have been dropped from the Medicaid program. So there's a whole redetermination process that's been ongoing since May 11th as the states rolled out various different cohorts. As presented in our report, we initially concentrated on the prenatal patients that we had and women that we had been serving that were Medicaid covered, make sure that they were getting eligible for MAP Basic if they're Travis County, eligible for our family planning grant programs with the state of Texas, and other programs that either if they're not eligible for MAP Basic medical access program and or for family planning, then they're enrolled in our sliding fee scale at community care. So all that has been ongoing. We recently switched our attention to our pediatric population because that's the next cohort going through. What you see clearly on this is you can see year over year again as presented earlier, but this case as it relates to trend on Medicaid, payer mix overall, you can see back in for the first quarter of our fiscal year 2022, which would have been from October 1st of 2021 through September 30th of 2022, we were at 38.7%. You see the subsequent year, it popped up a little bit. So you're seeing the trend quarter to quarter, pretty consistent until we hit this last quarter of this year. So when you compare it to the previous year, it was well over 37.9%. The impact we're already starting to see as it relates to our overall payer mix with an over 2.8% drop in Medicaid eligibility as a result of the redetermination process. And then when we look year over year, you can see it's a little bit over 2%, 2.1%, when you look at that 39.6 down to 37.5%. There's ramifications for us at community care, of course. Medicaid is a favorable payer for us overall, so there's financial implications, just like it is for any other health center in the state. The difference being we're very fortunate here in that for our patients who are Travis County low income, they then can become eligible for MAP Basic. So we've been working with our partners here at Central Health and Foundations committees to go ahead and make sure folks are getting enrolled, if possible, into the programs that are available to them. And so that means that at the same time there's a reduction in Medicaid, there's an increase in what we're seeing relative to MAP Basic. So if we can proceed to the next slide. This next slide, as presented within the report, demonstrates that as well. Recognizing it's a little busy, but if you take a look, unfortunately, the orange line, which is the percentage, what you're looking at there is the current year-to-date percentage of uninsured overall. You see that we went up from 47.2% the year before for the period ended September 30th of 2022 to jumping now to 49.1% by the end of September 30th of 2023. And then as you look, you can see uninsured Travis County residents immediately to the right. It's up by several percentage points, but if you take a look, the sheer numbers that are there, because the percentage doesn't necessarily communicate very effectively, the fact that there's also in the intervening time been an increase in service in the population. And so when you take a look at uninsured Travis County residents, we're up by almost 3,500, not quite, but 3,500 more uninsured Travis County residents year over year. That's the most substantial jump that I've seen since I've been with community care now almost 6.5, almost coming up on 7 years. So that's a very substantial. At the same time, we're increasing services as a whole. With redetermination, we're now seeing more folks uninsured that are coming through our doors based on our own data. And then we look at low-income uninsured, you can see the jump is even higher for low-income Travis County residents. It goes from 41,075 last year to 46,837. So that's a jump of well over 4,700 unique individuals that now are low-income Travis County residents. Many of those folks were actually being covered for the last couple of years through the Medicaid program, of course, right? Because of the continuous eligibility. So not surprisingly, if you look to the next bar, I wish I had a pointer for you guys, but I think you guys are following along. You look at Medical Access Program, MAP Basic, you can see that we saw a 4.3% year-over-year jump, and it went from 39,692 to 46,134. So over 6,000 plus new individuals year over year in terms of now being enrolled in MAP. That's the direct impact on the communities that we're serving in partnership with you as a result of Medicaid redetermination. Quite honestly, when we take a look at the continuous enrollment that happened as part of the COVID-19 pandemic, it's almost like for a subset of our populations, I think I'm through it, but I appreciate that. A subset of our population, be it prenatal, kiddos that would have otherwise aged out, or kids that were eligible for Medicaid or became eligible, they didn't have that redetermination. So we saw a continuous, almost an expansion of Medicaid at not at a full level, but at a very significant level within our community as a result of the pandemic. And now that's rolling back. So that has a lot of implications. And what you can see is relative to other payers, Medicaid, of course, coming down, as we've already talked, but private insurance really hasn't changed much, a little bit more, but not really materially when we look at a 0.3 increase in commercial or private insurance. And then our Medicare, which also includes dual eligible, so those are folks who are both eligible for Medicaid and Medicare, it stayed static year over year. So this is really, we're seeing a shift between Medicaid covered folks for the most part into low income uninsured and impacting both MAP Basic, as well as others.
Sorry to interrupt you. We lost our quorum. We're running very thin here tonight. And I don't think Dr. Martin realized that when he walks out, everything stops.
We'll take a pause.
We'll get back to you in just a second.
Thank you so much, Dr. Bell. Appreciate that.
There he is.
Thank you so much. So resuming, as I was mentioning, no real substantive change as it relates to the Medicare inclusive of the dual eligibles. So next slide is just our closing as it relates to our financials year to date. There's a lot more depth in the information we provided with a lot of metrics. Third next available, average lead time. You can see all the demographic information around the patients we'll serve each of the quarters, the 4 quarters, as well as a roll-up for the fiscal year within the package. So we're happy to answer any specific questions you have around that. But before doing so, just very quickly, as we concluded our fiscal year, these are unaudited financials. I want to go ahead and we're just starting to launch our audit. That'll come to our board in January for approval. It's also going to be presented in your audit as well, as you guys present us as a subunit of Travis County Healthcare District in the financials, giving our applicant, co-applicant relationship on the health center program. That stated, we ended our fiscal year unaudited to the positive, a little bit over $1.2 million for operating and derived revenue. A lot of that's based on Medicaid, as well as some of our pharmacy program expansion that's occurred over the last year. Coupled to that, we also had another $4 million in non-operating revenue. And you might be questioning, well, what is that? The non-operating revenue was a couple-fold. One is grants through the federal government as a result of COVID to help offset expenses relative to capital purchases for equipment. And so we'd outlaid the cash previously, but this is a repayment when we drew down the funds, and so there was a delay, so it's a timing issue on that. And then both recognition of funding received from Central Health in support of some of the new health centers, specifically Pflugerville, wherein Central Health had provided $2 million towards the construction of that new health center, replacement health center, a much larger health center up in Pflugerville overall. So that's what the non-operating is for. So when we take a look overall, we ended up with close to $200 million in revenues for the year. Again, that's the most we've ever had, coupled to roughly $198 million in direct expenses. Much of the savings on expenses and the underage there is directly related to workforce, right? And we're kind of each time we come in here, and I think I said last time, the biggest thing that we all have confronting ourselves is workforce related. How do we go ahead and develop that? One of the things we failed to mention in this report, now that I think about it, is that we did during this last quarter actually graduate our first cohort of medical assistant apprentices. We had a cohort of 10 individuals, mostly drawn from within the communities we serve. It's a relationship we have with a federal funder right now, but they come on as apprentices. We pay them as employees. They go through what was then a 12-week curriculum. We're going to expand it to 15 weeks. That's a learning for us. And 8 actually completed, 2 ended up not accepting, 8 went through the curriculum, and very pleased to report that 7 actually are full-time employed with us right now. So this is part of our Grow Our Own initiatives, and so we're looking at another cohort coming through in the upcoming year in 2024. So one thing we were remiss to point out there. So both Tara and I stand ready to answer any questions you may have, but a lot of our leverage funding is coming through pharmaceutics, pediatrics to help offset operating losses otherwise that would happen through our low-income uninsured adult population.
Thank you very much, Tara and Jason. Excellent information. Members, if you do have questions, I am going to limit us for 5 minutes, not per person, all right, for everybody's questions. So let's make it as concise as we possibly can. And I'm sure that Jason would be willing, and Tara would be willing to touch bases with members if their questions cannot be fully answered during this time period. So, any questions? Manager Martin.
Thank you. Thanks for the presentation. Is most of your revenue generated by patient encounters?
The vast majority of it is derived both through central health and third-party reimbursement. What's notable is our pharmacy program is also a net positive to the tune of almost $17 million a year now.
What is an average number of patients seen in a clinic by each provider on a day, would you say?
It ranges depending on what service line we're looking at. Pediatrics is a little different than internal medicine, family medicine, but our annualized expectation for one FTE family medicine doc, by way of example, is 3,750, which aligns very closely to what other health centers are doing across the country. So that's between 16 to 20 visits a day, sir.
Okay, thank you.
Yeah, you're welcome.
Thank you, Manager Martin. Manager Valadez, and then Manager Kitchen.
Hi, thank you all very much for presenting to us. We love community care. But is there a strategy in place that is going to help us expand the number of CHAP members, MAP to CHAP members? It appears as if we have had some problems in the past. And I wanted to know whether or not there's some kind of strategy in place to overcome that. And additionally, if that ends up becoming the situation, then are you working collaboratively with Sendero to make sure that that does occur, either through the call centers or whatever, and make sure you decrease the number of steps and making people having to hurdle in order to become CHAP members?
Yeah, so I think we're going to need to, thanks Manager Valdez for that question. I think we're going to have to defer to our peers at Central Health in terms of what the process is for converting folks from MAP to CHAP. We don't have direct line of sight, but what I can tell you is that last year we executed a different agreement with Sendero in terms of how we provide care to individuals who are part of their ideal care plan. And so there's been ongoing conversations, and I'm looking forward to renewing those, given some leadership changes of late. So with Sharon and others on her team, in terms of how we can strengthen that, especially considering that the MAP patients most likely were being served by us that would convert. And so we have a vested interest in both their health outcomes and making sure that that continuity of care through the primary care provider, which we represent, continues. So we're looking forward to that, but there's no direct plans on our side right now. We're waiting for that to happen.
Thank you.
Yeah, you're welcome.
Thank you very much. Any further questions? Manager Kitchen.
Just quickly, I'm wondering if you have any comment on the state's efforts around the re-enrollment. Do you see a difference? Is it just the same? Are we working with them? Just whatever you can tell us from your perspective in a brief time.
Yeah, so thanks for that thoughtful question, Manager Kitchen. I think the state, and I think this is general knowledge, so we're not sharing something that's unique to us by any means, but I think the biggest bottleneck for the state in the redetermination process is their workforce. Do they have enough individuals to be able to process these timely? Last that we heard, it's within 45 days. Credit due to the state. They did put into an appeal process with some pressure from CMS, a 30-day appeal process. One of the things that we did not think was a very favorable approach from the state's perspective, ma'am, and managers, is that as soon as someone was determined not to be eligible or they were non-respondent, they lost access to the portal online. And so they're trying to correct that. So there are some hard learnings there. I'm sure you've seen in the media that there are folks that we would see, including our patients, who otherwise should have continued to be enrolled, that were disenrolled either through incidentally disenrolled as part of another individual. So, for example, the example I gave earlier, a prenatal patient, she was disenrolled. There's examples where the entire family got disenrolled, even though those kiddos were going to be eligible otherwise. We're very grateful that the Biden administration has put forth a requirement for the Medicaid programs that anyone who is deemed eligible that's less than 18, if they are enrolled by the end of this year, their Medicaid programs across the country are required to have continuous enrollment for the 12 months of 2024. So there are certainly opportunities for the state to do better by the Medicaid enrollment redetermination process, but they've been trying to be responsive. And so I think when we're working with them, there seems to be a little bit of progress there, but there's still a lot of confusion out there and a lot of opportunity.
Thank you very much, Jason and Manager Kitchen. Manager Jones.
Just one quick question, yes or no. What impact, if any, with the opening of Chalmers will be having at the Houston Tillotson?
I don't know if that's Manager Jones, a yes or no answer. I would say we don't expect it to have a direct impact. Actually, to the contrary. We just looked at, so I'm to the next quarter, but Chalmers is starting to actually see and getting close to what our expectations are for that site. We looked at Consolidated Medical, so I can't speak to the dental off the top of my head. At the same time, we saw increased activity above what were our expectations were for the month of October at Sandra Joy Anderson. So at least that preliminary data indicates that there's no impact on SJA right now, sir.
Okay, and second question related, congratulations on your award from CDC. I actually worked with the division of HIV, STD, and TB back in the day, so I was wondering, that's unique to, it's not a grant, but it's a collaboration. Am I correct in saying that?
Yes, sir, you are correct.
Okay, I'd like to talk with you all offline about that, but congratulations.
Yeah, I appreciate that, and that just demonstrates the hard work of our sexual health team in securing that grant. They did a unbelievable job in that application. Tara helped lead with that as well as Dr. Stefanovich, Mike Stefanovich, and others, Dr. Ugota. Thank you.
Thank you, Manager Jones, and I echo those congratulations to you. Thank you very much,
Thanks, Dr. Bellows.
Tara.
Thanks to all of you for having us this evening.
Thank you so much.
Jason, really appreciate it. Thank you. Okay, Sendero. Welcome, Sharon and Ellie.
Do you have any of those?
Oh, and Dr. Jennings.
Oh, thank you very much. Thank you all for having us. We have a very brief agenda that she might put up here for us. So we're going to talk about the joint analysis exercise that's gone on between Central Health and Sendero. Dr. Jennings is going to walk us through that. And then we're going to talk briefly about the operations and the open enrollment for 2024 and what's going on in that regard. And then we have the 2023 financial year-to-date projections. Actually, it's the budget projections from the third quarter, right? Okay, Dr. Jennings, you want to take it away?
Sure, and I'll,
Excuse me.
I think this is about 3 to 5 minutes of content, more on the 3 side, and if possible. Can everyone hear me? Just a sound check. All right, thank you. Thanks for having us here tonight. I focused my updates on the progress that the Central Health and Sendero teams have made on our joint analysis exercises, which we've labeled the effort that both this board and our own board asked us to undertake to study the CHAP expansion, population, and other ways to optimize our offerings to really ensure that we align every opportunity that we could identify with supporting Central Health's mission. John Morgan on the Central Health side is kind of my counterpart, and we've caught up recently to assess our collective progress. And I think overall we've been really pleased with how our staff and our from both organizations have really come together and made significant progress on the objectives that I've shown you all before, and we're bucketing into 3 categories here. So the objectives, kind of the content that I'll present just right now, is around plan and benefit design matrixing. So this was one of the requests that our board helped us articulate. The second one is around CHAP expansion, premium assistance program optimization. And the third is around financial analysis. And so the focusing on bucket number 1 here, we put our heads and our staff together and have, through a number of months of analyses, come up with a couple of outputs. And the 2 to highlight here are that 99% plus of the MAP and MAP basic providers are within network or in network with Sendero. There's the kind of 1% is just a kind of a rolling indicator, and at any point the network's in line, essentially. And then second, Sendero's benefits offer unique access to specialty services. And so we got to those statements through looking at our benefits, comparing them, looking at our networks, and really crosswalking them. And then the kind of the highlight here is that these efforts, these kind of continuing conversations we've all had, have resulted in facilitating some long-going conversations or long-standing conversations into a new offering this year that you'll hear more about later. You've heard about previously as well in other meetings, what we're calling a Map to Silver offering that's gone live for this 2024 open enrollment. Under the green bucket of the CHAP expansion, premium assistance program optimization efforts, we've broken that into a number of aims. I'll present 3 here. The first one was to optimize re-enrollment of our current CHAP expansion members, and we've been working with around 750 of those members. That population is about 750 members, and we came to an evidence-based decision together on that, and that's that after multiple analyses, we've come to consensus that we should invite all of those current CHAP expansion members to re-enroll. And so that's underway and well underway. Aim number 2 was to optimize new enrollment. And our decision there has been that our continuous year-round enrollment and our open enrollment will both proceed in a risk score-based approach. That's what we've done in the past, and that's what we're going to continue. We have articulated a value proposition for a number of clinical topics. So one is for bone marrow transplant, and the kind of other outputs of that are that cancer and that transplant program seem in general to be a good fit to have a good value proposition as our population health analysts and our financial analysts have run that for the CHAP expansion program. The next steps on this aim number 2 include continuing our analysis on, I guess, the value proposition for the clinical cohort-based enrollment. And we have just a meeting scheduled tomorrow for looking at kidney disease. And we've also drafted a procedure that will govern that, specifically the continuous enrollment procedure, the processes around that. We're meeting to resolve outstanding edits tomorrow with our two teams on that. And then number 3, our aim was to improve understanding of appropriate outcomes, and the brief status report on that is that planning and scoping are underway behind the scenes for this idea of a longitudinal study that leadership had proposed. And then under the bucket number 3, the gray bucket over here, financial analyses, I think when we started this effort, we were expecting to have discrete outputs here, but what we've really found is that in each of the other decisions, the other analyses, that financial inputs have really factored significantly in there to inform all our decisions and our recommendations. So those are part and parcel of the other outputs and kind of progress that I'm able to share to date. We'll take questions.
Any questions? Dr. Jennings.
We'll take questions at the end. Okay? So we might call you back up, Dr. Jennings. And before the next presenter, just so members know, we now have 1 over a quorum. So if you do need to step out, you can. But 2 people can't step out. All right? It's only 1. Thank you. Next one.
Okay. Just to bring you up to date on the open enrollment and the outreach, open enrollment started on November 1st. We're 2 weeks in, and we've extended our call center in the hours, so they're covering weekends as well to take calls from members in outreach. We also have implemented an auto dialer system, which confirms that the member has not already enrolled and reaches out to existing members and tries to re-enroll them into the process. So we've also put agents, all of our call center staff are licensed as agents, or a huge selection of them. I'm not certain everyone. I don't think we got everyone on board entirely. Did we, Tiara? I think 7. Yeah, 7 of them are. So it now allows us to manage more patients that call in that process. So it's going well. You can see the literature that we're doing. By the way, I also have, if anybody is interested in having any literature to put in an office somewhere or share around, we have some literature that we can share about it, and we'd love for you all to help us promote this process. Bless you. Thank you. And the other thing is we do have the Turkey Fest that is occurring Friday. And so we'll do the giveaway of the turkeys that we have done consistently for a number of years. And we hope to maybe get some publicity out of that in the process. And again, Centero once again received the highest rated exchange plan in Texas for the 3rd consecutive year. Again, as our thing says, we are the only 4-star in the Lone Star State. So no other plan in Texas has been given this award. And I think it speaks to the dedication of this team. They work really hard to try and take care of the members, and it's really important aspect about it. I promise that we're sort of talking about the 3rd quarter, and our lady here has been, Ellie has been working on trying to get the statutory report that has to go out to TDI today. So it's a constant battle to kind of keep up with all the pieces. So this is the 3rd quarter. I wasn't employed in the 3rd quarter, so we'll get back when I can report in January. I'll bring more information to you all and try and give you a little bit better detail about some of the things that are going on. But certainly it's been a busy initiative with a lot of things happening at this point. And I'm going to turn it over to Ellie and let her walk you through the 2023 financials.
Thank you. So you all received the budget. This quarter, it's a little different from what normally is presented because usually the fluctuation is based on enrollment. We projected 10,800 last year when the budget was approved, and we enrolled 6,600. The reason why you are seeing losses of 4.1 million and you're seeing lesser revenue, so I'm just gonna kind of tell you overall what you're gonna be seeing on that column for 2023, the last column, is you're seeing a decrease in revenues from what was expected, or at least we were at 37, now we're at 38 million, and risk adjustment went from 21 million to 4 million. So the reason for that is we have discussed the risk adjustment haircut that took place for this quarter, and therefore we're seeing a significant impact on that risk adjustment receivable for Q3. And then total medical expenses are at about 80%, 79.7%. And so you significantly have a loss of 4.1 million. Technically, that loss is reflected on the 9 million loss of the haircut as reported by CMS. So that's mostly what this represents. If we were not presenting that loss of the haircut, we would actually have a net income of about 4 million, 4.5 million. So that that's pretty much the meaning of the financials today. Nothing has really changed from the trends that we were bringing as of June. It's just that risk adjustment haircut. And that's all I got to present. Any questions?
Does that conclude?
It was very quick.
All right. Appreciate that. Members, again, 5 minutes, and I will take those who have questions. Also want to remind members that we have a closed session time with Sendero, where we will talk in depth about their budget. Not as in depth as they would like for us to talk about it, but you got a draft, and so they'll be reviewing that draft with you. Manager Martin, did you have a question? No? Manager Valadez?
Yes, I'm gonna ask the question that I asked Jason at Community Care. I'd like to know if you all have some kind of collaborative effort going or strategy in order to keep your CHAP patients and expand the number. But are you working with Jason? Are you working with Central Health? Because I think Kit is the one in charge of eligibility. Is that a different process, or do we need to modify the process? Because I have actually spoken to some people that appeared to think that the process was very difficult. You know, they had to talk to one person, they had to somebody called them, and they had to talk to somebody else, they had to talk to somebody else. And it's, you know, when you have to talk to more than one person, you're going to lose people. And I just wanted to know, I don't know who can answer it, if it's Sendero or if it's Mike, is there a way to simplify the process? Because we're trying to help our enterprise members and ourselves.
Dr. Jennings, you want
I
to
could
take a stab at that?
try to
That's
address
working
some
in her
of
realm,
that.
her
Yeah.
department.
Yeah.
ahead.
So our team started outreach to, so when we outreach
On
our
their own.
Yeah, right. When our team, our care management team starts mostly phone outreach to the current CHAP expansion members, they're doing an assessment there, which is just part of their kind of usual outreach and their usual kind of program services. They're also verifying eligibility under kind of against the list of requirements that kind of Central Health and Sendero have in place. And then there's a handoff to the Central Health team once the person has been kind of verified to meet those requirements. And we have I think we have successfully really improved the process year over year, and I wonder if that's what you're hearing as well. But we understand there's still, because we can't kind of fit those two functions into one. Like Sendero can't approve the financial, enrollment of the member because Central Health kind of holds that function. We'd be happy to hear more, kind of more of that perspective on kind of what the discrete suggestions are for how to improve that process. I know that we hold debriefs and really do try to identify pain points from the members' perspective as well as from staff opinion about what can be more efficient each year. I think we've started earlier this year and like really pushed that outreach and tried to meet members where they are and make it as easy as possible for them. But I understand that it's a hassle, and there might be challenges that they're really hard to overcome. Do you have specifics, or could we talk offline later?
Yeah. So I would concur with what Dr. Jennings said and emphasize that with each year in this process, there are process improvements that take place, but by no means can we ring the bell and say that we're finished making improvements, because each year you're going to pick up things that you can do to improve. The only other thing that I would add is there was a board imperative that was established early on in this program that individuals be given a choice, and as to whether or not they wanted to move from MAP to CHAP. And I don't recommend that you back away from that imperative, because insurance or health plans, they can be complicated. If you've never had a health plan before, or maybe it's been a while, but also understanding how to optimize the health plan and make it work for you. And so it's really giving a lot of space to the individual to decide, is this a transition that I want to make? Now, anytime you put a step like that in a transaction, it does result in a handoff, if you will. And you go from one environment to the other to then exploring what are the options here. And so, that's going to be inherent. But again, to echo what Dr. Jennings said, I think each year before you start the process, you take the lessons learned and from the after action and try to make it better. But I just wanted to add that as commentary to what Dr. Jennings said. And I'm sure there's some other technical experts here in the room sitting behind me that might offer some additional information. Right.
Well, basically what I wanted to just say from the people that I've spoken to is that they were not given a clear understanding of what the actual differences were in being a MAP or MAP basic member as opposed to a CHAP member, and what that ultimately mean to the quality of care that they would be receiving or have access to. This is a comprehensive health care plan as opposed to these are services that you're entitled to under MAP. And especially in light of the high risk patients or members that we would be talking to. I just didn't understand how people couldn't understand that. As someone who used to enroll members in the insurance plan as a federal navigator.
Mike, did you have any addition?
I just wanted to say duly noted, and
if you're really sick,
one of the challenges that we have, and you would see this in any jurisdiction, is that when you try to compare a medical access program or a program like medical access with an insured plan, it is, while they on some level they seem similar, when you start really getting into them, they couldn't be more different. And this is something that early on that we learned in conversations when we first started this program with individuals, is really trying to zero in on how best to have that conversation. And it really is individual specific. And so, again, that's just one of those areas where we've got to continue the improvements and coordinating with each other in terms of how we have those conversations to enable that understanding, because it is going from a very, it is jumping between two distinctly different worlds.
I understand. So maybe that's something that Sendero, working with Central Health, your staff together, trying to figure out how to distinguish those distinct differences and to make sure that our prospective member or patient will understand that.
I do know that Dr. Jennings' staff is making intensive outcalls to all of these. I think there's 750 chat members that are in
Currently.
the listing. And we are getting a daily report, and they have worked weekends to try and get through this list. And I think they're on their second and third outreach to some of these, and sometimes you don't read them. But I completely agree with you. We probably need to get together and see if we can't streamline the process a little bit. If nothing else, standardize the retraining tools.
That's right.
So that both people are looking at the same things and we're saying the same things, so that when someone's trying to understand, but I think, I agree, I think we probably need to,
It's a cross-training situation,
yeah, that's right.
cross-trained. Thank you.
Good suggestion, thank you.
Thank you, Manager Bell. Does Manager Jones, did I see your hand?
No, I just want to say this is one of the challenges we have with health plans in in a hospital district, from my perspective. And until we're able to get people to understand all of the nuances there, I think the role of a health plan is still challenging, whether it's other or other hospital districts in the state. So I just want to add editorial.
Thank you, Manager Jones. Manager Motwani?
Some things I'd like to discuss around the budget. I think closed session would be more appropriate.
Sounds good. Manager Kitchen? No? Okay. Thank you. And thank you very much. We'll be hearing from you again very soon. All right. The next three agenda items will be taken up in closed session. So I will read those agenda items and then read my language for closed session. So agenda item number 3 is to receive an update on Sendero Health Plan's draft budget for calendar year 2024. Agenda item number 4 is to discuss and take appropriate action on an update on the proposed FY 2024 Central Health Funding Plan for certain Sendero Health Plan claims and administrative costs. And agenda item number 5, discuss and take appropriate action on Central Health owned and occupied real property and potential property for acquisition, lease, or development in Travis County, including pending issues and next steps in the redevelopment of the Central Health downtown campus, administrative offices of Central Health Enterprise Partners, and new developments in eastern Travis County. I announce that the committee is convening in closed session to discuss agenda items 3 and 4 under the Texas Government Code, Section 551.085, Governing Board of Certain Providers. .071, consultation with attorney, and Texas Government Code Section 551.072, deliberation regarding real property. It is 5:17 p.m. on Wednesday, November the 15th. Ready? All right. We are now back in open session. It is 6:55 p.m. on November the 15th, 2023. Under the agenda item 3, there were no motion necessary. However, I would like to recognize Manager Matwani for a motion on agenda item number 4.
Thank you, Chair Bell. I move that the committee recommend that the board authorize the Central Health CEO and President to execute a financing agreement with Sendero Health Plans for calendar year 2024 and future periods of CHAP high-risk program costs.
I have a motion from Manager Matwani. I have a second from Manager Valadez. Any further discussion? Hearing. I'm sorry?
Yeah,
Sure, go ahead.
The motion was to make a recommendation and bring it back for us. Is that correct?
The lawyers, no?
As it's worded, it's the president and CEO can execute the agreement.
Okay, I didn't hear the execute part. I'm so sorry.
Yeah. All right, are we clarified? All right, here, any further discussion? Hearing none, all in favor?
Aye.
Any opposed? Any abstaining? Show Manager Jones as abstaining. The motion carries. Thank you very much, Jeff. There was no motion necessary on agenda item number 5. Agenda item number 6 is to confirm the next Budget and Finance Committee meeting date, time, and location. Managers, our next Central Health Budget and Finance Committee meeting is tentatively scheduled for Wednesday, December 13th, 2023 at 4 p.m. at the Central Health Headquarters, 1111 East Cesar Chavez, Austin, Texas, 78702. At this time, I'm ready to accept a motion from Dr. Zamora for adjournment and a second from Manager Jones. Any discussion? Hearing none, all in favor?
Aye.
Any opposed? Any abstaining? We are adjourned. Okay, managers, we will go right into the board meeting, and I will explain what happened to the executive committee meeting. Good evening. Today is November the 15th, 2023, and it is 6:58 p.m. As a quorum of the board is in attendance, I'd like to call to order the meeting of the Central Health Board of Managers. Managers, because a quorum of the executive committee was not able to be present in person for that meeting, the items on the committee agenda will be taken up by the full Board of Managers in this meeting, which was posted at the same time and location. We will now proceed to public communications and then the items from the executive committee agenda. First item of business is public communication. We will receive the public communication for both the executive committee and the Board of Managers meeting. Members of the public who wish to make comments during the public communication portion of the meeting must have registered with Central Health via an online form or by telephone no later than 2:30 p.m. today. We did not have anyone registered to make comments. We will now proceed to the executive committee agenda. Agenda item number 1, approve the minutes of the Central Health Executive Committee meeting October 25th, 2023. Manager Valadez moves that the board approve the minutes of the Central Health Executive Committee meeting October 25th, 2023, and Manager Jones seconds. Any further discussion? Hearing none, all in favor?
Aye.
Any opposed? Motion carries. Agenda item number 2, review and take appropriate action on the following: the prioritization and tentatively scheduling of items for consideration at future Central Health Board and committee meetings, and the proposed calendar year 2024 meeting dates for the Central Health Board of Managers. Brianna Yanis will be presenting.
Okay, I'm going to start with December 6th. We have the Eastern Crescent Subcommittee and Strategic Planning Committee meeting. And our items for that agenda are the minutes and then a Black Men's Clinic update. And then Mike has one other item that potentially, if he wants to speak to that.
Yes, and so I believe there was, and I'll actually defer to Manager Kitchen on this, but communication regarding an item to be brought up at the Strategic Planning Committee meeting. It just didn't make it on the documents for this particular meeting regarding having a conversation or a discussion with At Home regarding the services and issues around homelessness. But again, I'll defer to Manager Kitchen if there's any more explanation, but this will be subject to the call of the chair of that committee. Thank you.
Yeah, I reached out to the Dr. Brinson. I haven't connected with her though. This is for my colleagues. Finding Home ATX is some of you may be familiar with them, some of you may not, but it's a community organization that focuses on fundraising around services for homeless individuals. They also, when they first started a number of years back, they also focused on trying to bring together different aspects of the community for a more unified look at what everybody was doing. So anyway, they have asked if they could come and just present to the committee and let folks know what it is that they do. My thought is that it would be useful to do this. They're not a service provider, okay? They are an entity that is so they don't have any contracts with Central Health, and they're not asking for any contracts. They are just wanting us to be aware of their role in the community. Maybe there's an opportunity to partner with them at some point. But since we're starting to have more conversations about serving people who are unhoused in our community, I thought it could be a useful thing to do. It doesn't have to be a long presentation, but I thought you all might want to hear from them.
Okay. Any other questions? Are we finished? No, go ahead. I'm sorry.
Continuing on December 6th, we're going to also have an ad hoc nominations committee meeting where we'll nominate candidates to serve board officer positions during calendar years 2023 and 2024. And then December 13th, we'll have Budget and Finance Executive Committee and the board meeting. At the Budget and Finance Committee meeting, we have the October financials, the Sendero budget approval, and an update from Travis County Investments and Markets, and approve the fiscal year 24 investment policy. For Executive Committee, I currently have minutes and tentative schedules, and then I also have, this is the item analysis looking at homelessness that you brought last meeting. I'm not sure if that needs to go on Executive Committee or a different meeting. If it was supposed to go on the board meeting or Executive Committee.
And that's the analysis of looking at homelessness?
Yeah.
Is that what Ann just talked about?
I think that's
that's what you brought up last meeting.
Yeah,
I
I don't know
up.
if it'll be ready. I don't know if it'll be ready for that. I mean, basically, that is the meeting that the mayor
Oh,
has
that's the
called.
mayor meeting. Yeah.
Yeah,
No.
and so I think we were
not.
anticipating that there
Okay.
might be some activity out of that we needed to bring back to the board.
Yeah.
Okay. So I'll
Yeah,
push
you're
that.
right. I did talk about that. That group hasn't met, so, and it's not planning, at this point in time, the plans were to meet in the middle of December, which is after our next board meeting.
Yeah,
So, it would have to be in January that if they do
Right.
have a meeting, someone will give an update.
Okay.
Okay.
I'll push that.
Does that make
to
sense?
And then for the board meeting, we'll need to have a public hearing for the LPPF setting the FY24 rate. On consent, we'll have minutes, investments, the Sendero budget approval, and the approval of the FY24 investment policy. And then we'll also elect the nominated candidates to serve board officer positions. We'll have our regular standing items, performance review update, lawsuit updates, potentially an update for mental health care, may move that to January. We will have our open government and conflict of interest training, HR, state of the organization, and EEOC report demographics. And then lastly, at the end of this month, we have our CEO second round interview scheduled. We have a dinner scheduled for November 26th and an interview scheduled for November 27th from 3 to 5. And a dinner scheduled on November 28th, which is a Tuesday, and the other interview is scheduled for November 29th from 3 to 5. And that's all I have.
Let me just add to that, if that, is that all right, Chair, if I take?
Yes,
a
go
minute?
ahead. I was going to add to it too. So you go ahead and.
Oh, you want to go
No,
first?
no. Go ahead. You
Okay.
do it, and then if there's something you left out, I'll join in.
Well, I think that the thing that's really important or one of the things that's really important is that there was a media advisory that went out today about the scheduled community forum. And that community forum is occurring, I forget what days those are. It's the same days that we interview. So it's earlier in the day, and it involves a panel that Ted is going to moderate and ask questions, and then they'll be taking some questions from the community, the folks that are in the audience. And then there's an opportunity to mingle after that. So I think I wanted to bring that to everybody's attention. The media advisory went out today. I can't see if Ted's there. I don't know if he wants to add something, but the media advisory went out today, and I would encourage you all to encourage people to come because it is an opportunity for them to meet the candidates.
Okay. And
Did you want to add anything?
Yeah, what I wanted to add was that members, you just remember that these second round of interviews, they're board meetings. They're not succession committee meetings. So the entire board is asked or requested to be here. So just make sure that you remember those dates and that they're not committee meetings. They're actually board meetings. Manager, go ahead. Manager Kitchen, and then I'll recognize Manager Valadez. She has a question.
The other thing I forgot to mention was that the names are not public at this point. They will be, obviously, when we do the community forum, because that's a public event for people to come to, but they're not public yet. So I would just ask everyone not to. I mean, we're still under the confidentiality in terms of those names. And Ted, you maybe want to speak to us about when and how that works in terms of those names coming forward.
Go ahead, Ted.
If you have a question about the media advisory or what's happening on Monday or Wednesday, is that?
Did you?
Yeah, I wanted to know, we've got the media advisory that doesn't name the finalist. Obviously, when we do the community conversation, they're going to be right there and people are going to know who they are. So my question is, what's the timeline between now and the community forum at which we make it known to people? And we might need to take this offline if that's something that we haven't discussed yet.
So,
go ahead.
Ted Burton, Chief Communications Officer. The media advisory went out today, and as you mentioned, Manager Kitchen, it does not have the name of the finalist.
That's right.
But it explains the details of the community conversations that are happening a week from Monday and the following Wednesday. And there's a whole communications cascade going along with that. So an invitation to our community members. About 7,000 members have opted into that email distribution list, of course, promotion on social media. And then when Jeannie and the search firm is ready, we will do a press release that will include a short bio of the finalist. But we don't have that yet, but we will be prepared to release that, obviously, the day of, because they'll be here. And we do anticipate members of the media will attend the community conversations as they did last time.
So I would just
Sure,
ask
the community,
everyone-
Monday, November 27th, from 11 to 12:30. So 11 to 12 is the community conversation here in our boardroom. 12 to 12:30 is a meet and greet. So community members can meet, ask questions one-on-one with the candidate. And then we'll do the same exact thing on Wednesday, the 29th. So again, here in our boardroom, 11 o'clock to noon is the community conversation. Noon to 12:30 is the meet and greet. The meetings will be broadcast on Facebook Live. We record them. They will stay on our YouTube channel, on our website. And so we'll continue to promote those even beyond the actual meeting itself. And So for those who cannot attend or aren't able to watch at that time, they can view it later.
Thank you, Ted. I would just I would just ask everybody to respect, to just respect the process. And you may, at this point, you may start getting the pressure to tell people who the finalists are, but please do not.
Okay.
We want to respect this process and the process that Ted is going through with reaching out to the community.
Okay, thank you, Manager Kitchen. Manager Valadez.
It was always my understanding that this was going to be for the benefit of the community, and it has been my experience that the community doesn't normally come to meetings at 12 noon or 11 o'clock in the morning. So I'm curious, and we didn't do this the last time. It was done in the afternoon, late afternoon, 5:30, and it was done in tandem with a board meeting. So why are we doing this in the middle of the day?
The schedule.
We were working with the schedule with the stakeholders, and the middle of the day.
I'm sorry, what stakeholders? The candidates?
Part of it was the candidate schedule, and then part of it was the panels that needed to be set within the organization for the other internal interviews, as well as the Board of Managers' availability on those days.
I'm sorry, they're going to be interviewed by a separate panel of interviewers?
Internal.
The staff.
Internal, the staff.
Yeah.
So where's the community component of this?
Manager Valadez, if I
Yes,
can speak
please.
to this. Yeah, and we've had these discussions in the succession committee. We discussed the process early on. So basically the interview
Not
day,
the timing.
Yes, okay. The interview day involves interviews with internal staff. It also involves this community forum, which I understand was something that was done before. And then it also involves the whole Board of Managers interviewing the candidates. So, I hear what you're saying, I hear your concern, but other people would say that it's difficult for them to come at the end of the day, that it's easier for them to come around lunchtime. So we have to do the best we can, and I respect Ted's judgment on this in terms of reaching out to the community. So I think that's where we're at right now.
I appreciate that. I just don't agree with it. Thank you.
Thank you. All right.
I'm going back old school to cut the chair because I always forget to look at my computer calendars. That's why I was going to put it in my back pocket. I will be here.
Sounds great. Appreciate that, Dr. Zamora.
For the record, we're working with a schedule that was also provided to us. That included the entire day beginning at 7:30 or 8 o'clock that morning.
Yeah.
So
that's
what I understand is the schedule of the two candidates as well. So.
Mm-hmm. Now, I guess if
I'll let you go, but I want to say something.
I appreciate that. I would have appreciated knowing that we have to go by this candidate schedule, but I do believe that the misnomer here is community forum, because I don't believe a community forum, to me, for us to have our board meeting, we normally don't meet at 11 o'clock in the morning. And so I'm just, enough said on that. It's not how we did it before, and I do appreciate that. We did it in the afternoon, evening.
It was midday.
That's correct. It was midday. And it had to do with the scheduling. So thank you very much. We appreciate your input.
And the community conversation started at 5:30. Thank you.
Thank you. All right. I think that is the end of your item. All right. Boy, you're long-winded today. Come on.
So in your backup, you should have a proposed 2024 meetings calendar. When I drafted this, I just went exactly how we did this past year. It's the same weeks, same days of every month, and we are just asking for your approval.
Okay. All right. So we are in. Any questions about the calendar year meeting dates for 2024? Hearing none, I would accept a motion from Manager Jones. I move that the board approve that the proposed calendar year 2024 meeting dates for Central Health Board of Managers as recommended by staff. Do I have a second? I have a second from Manager Valadez. So any further discussion? Hearing none, all in favor?
Aye.
Any opposed? Any abstaining? Motion carries. Okay, agenda item number 3. Discuss research and survey reports and their alignment with the board responsibilities and level of desired engagement, including but not limited to such reports regarding the monitoring of delivery of care and health outcomes and other relevant information. I'm going to lead this out right quick, and then I'm going to let Mike add to what I'm going to say. This item is really a start of a discussion that the board needs to have with regard to the numerous reports that are presented to the board over the year. Part of that discussion has to do with being able to outline what data is available and have you guys sort of ask or request the types of data and the types, or not the types of data, but from the data, what types of reports do you feel are appropriate? As opposed to, as the staff comes in and presents, then we ask for additional reports at that point in time. We feel that that has, those reports should have a touch point on what we need to provide governance on. All right, so in essence, we should be asking for things that actually influences the policy and the guidance that we want to give the organization. So, Mike, you want to sort of add on to that?
Thank you, Chair Bell, and that's an excellent tee-up. And the one question is why are we having this discussion? And in the past, you all have indicated an interest in talking about the scope and the depth of reports, albeit usually as one-off comments made while we were presenting something to you all. But also, this is the time of year at which we start our staging work and really thinking about starting at the first part of the year, January, but in earnest in February all the way through June, to start to line up the report, which lines up with the work that has been prioritized by the Board of Managers. So this is not just things that we think up. It's really to align with the work and the priorities that you all have set, as well as some standing reports. So, for example, the utilization reports that we provide year in, year out, regardless of any clinical related type initiatives that we launch. The other reason for bringing this to you all is you all really need to start thinking and talking about what is a board level of knowledge. And you've just approved key performance indicators as a part of your ongoing reporting structure, and that's significant because you're talking about looking at the dashboard for an entire healthcare system, not an activity report around a certain type of clinical launch, for instance. And so your thinking and your scope is going to be much, much broader. And there is certainly no shortage of intellectual curiosity around this table, and I appreciate and admire that, and I think that's what makes for a great board. But also understanding that intellectual curiosity, if it's not lined up with a specific function or role of the board, especially the new environment that you're going to be in, and really zeroing in on what is an appropriate board level of knowledge and awareness, that intellectual curiosity translates into a lot of additional work that is not lined up with what the board objectives are, but also keep in mind, it's not just one person sitting down and writing reports. It is a team of people collaborating over the course of the year to be able to stage all of this. And they have, there's internal reporting, if you will, that is needed when you start thinking about healthcare delivery and strategic alignment, support operations, ranging from HR to joint tech to procurement to facilities. And so, again, just kind of wanted to throw that out there just to get a high level of awareness of what the landscape is and hopefully start some discussion. I think this is really going to be pertinent as you think about a new CEO coming on board about what that work stream looks like. Happy to answer any questions.
Yeah, managers, if you have any questions, you can answer them. you can ask them. And But this item will come back. So this item has to be worked much more in detail than what Mike and I just discussed. We just wanted to sort of give you the overview of what needs to be done as you move into the future. Any comments or questions before I go on to the next agenda item? All right, hearing none. Thank you, Mike. I appreciate that. We will now move to the Board of Managers consent agenda. Managers posted. Item C8 was already voted on by the full board during the executive committee items, and we will be taking up item C9 later in the meeting and seeking a vote on that. So those two items have been removed from the consent agenda and the motion. So I am going to read through these items, and when I finish, I'm going to ask any members if they're okay with any of them or if they need any further explanation of any of the items. If I don't hear anything, then Manager Motwani is going to move that we approve the consent agenda items. All right. Consent agenda C1, approve the minutes of the Central Health Board of Managers October 25th, 2023 meeting. C2, receive and ratify Central Health investments for October 2023. C3, approve two final candidates to move forward in the next steps of the President and CEO interviewing process as recommended by the Ad Hoc Succession Committee. C4, approve that in lieu of selecting an interim President and CEO for Central Health, the board follow Article 9, Section 9.2 under its bylaws, which states the assistant administrator as described in Section 281.027 of the Texas Health and Safety Code perform all the duties of the president and CEO necessary for the operation of the district until the board concludes the president and CEO search and secures a candidate as recommended by the Ad Hoc Succession Committee. C5, approve action on revisions to the Central Health amended and restated bylaws as recommended by the Ad Hoc Policy and Bylaws Committee. C6, approve the reappointment of Mr. Amit Motwani and Mr. Jeff Knodel to the Sendero Health Plans Board of Directors as recommended by the Ad Hoc Appointments Committee. C7, approve the reappointment of Ms. Patricia Young Brown to the Integral Care Board of Directors as recommended by the Ad Hoc Appointments Committee. C10, approve action on a proposed FY 2024 Central Health Funding Plan of certain Sendero Health Plan claims and administrative cost as recommended by the the Budget and Finance Committee. All right. Any of those that need further clarification for any board member? Hearing none? Oh, you have one.
Item C10, can I pull that and have it voted on separate?
Yes, you can.
I request that.
And let me clarify with legal, that wasn't the vote that we took on the Sendero Health Plan after we came out of closed.
Yes, it was.
So we have already voted on that.
Correct. But it was a recommendation to the full board.
Oh, it was recommended to the full board. It wasn't, okay, all right. All right, so C10 is out. Any others? Hearing none, Manager Motwani moves that the board approve consent agenda items C1 through C7. Any second?
Second.
I have a second from Manager Valadez. Any further discussion? Manager Motwani.
Sorry, it's just clarification. So the one we voted on was a recommendation. Was that the one we voted? Was that in Budget and Finance, or was that in the merged executive committee?
No, I know we've had many meetings today, and they are all sort of running
Well, I
together.
was wondering if we did it in the merged executive committee meeting when we got out of close. Oh, no, it wasn't Budget. It was Budget and
Budget and Finance.
Okay, sorry.
It was in the Budget and Finance, and the lawyers are telling me that unless they're finding something different as we speak, but they're telling me that we move to recommend to the full board. So that's why it's on
Yeah,
consent.
that makes sense.
Okay. All right, any further discussion? Hearing none, all in favor? Any opposed? Any abstaining? Motion carries. I'll take up agenda item C10. Approve action on the proposed FY 2024 Central Health Funding Plan of certain Sendero Health Plans claims and administrative costs as recommended by the Budget and Finance Committee. Manager Jones, did you just want to have a revote on that, or did you have a question?
No, I just would like to revote, so I'll be on record as voting.
Abstaining.
Yes.
All right. Do we have any further discussion? All right. Manager Martin moves to approve the action on the proposed FY 2024 Central Health Funding Plan of certain Sendero Health Plan claims and its administrative costs. Do I have a second? I have a second from Manager Valadez. So I have a motion from Manager Martin, a second from Manager Valadez. Any further discussion? Hearing none, all in favor? I have any opposed? Any abstaining? I have Manager Jones abstaining. The motion carries. Thank you, members. All right, managers, we will now return to the Executive Committee items 4 and 5 and the regular agenda for the Board of Managers, all of which will be discussed in closed session. So, agenda item number 4, discuss and ratify the President and CEO's contract extension through December 31st, 2023, and delegate authority to the Board Chair to negotiate additional contract extensions as necessary. Agenda item number 5, conduct the Central Health President and CEO exit interview. Regular agenda of the board meeting, agenda item number 1, discuss updates on matters related to a performance review contracted by Travis County, including delegations to the President and CEO to execute necessary agreements between Central Health and Travis County and Mazars USA. Agenda item number 2, receive and discuss a briefing regarding Travis County Healthcare District doing business as Central Health versus Ascension, Texas, Seton Healthcare Family, cause number D1GN2300398. That's 3000398. Agenda item number 3, receive and discuss a briefing regarding Birch et al. Versus Travis County Healthcare District doing business as Central Health, and Mike Giesland, cause number D1GN17005-824 in the 345th District Court of Travis County. Members, at this time, I would like to announce that the board is convening in closed session to discuss Executive Committee agenda items 4 and 5 under the Texas Government Code, Section 551.074, personnel matters, and/or Texas Government Code, Section 551.071, consultation with attorney, and Board of Managers regular agenda items 1, 2, and 3 under Texas Government Code, Section 551.071, consultation with attorney. It is November the 15th, and it is 7:29 p.m. All right. There's 5 of us here.
Yeah.
We are ready to go. We are coming out of closed session. It is November the 15th at 8:19 p.m. The
Motion?
need a motion on agenda item number 4. Manager Valadez moves that the board ratify the president and CEO's contract extension through December 31st, 2023, and delegate authority to the board chair to negotiate additional contract extensions as necessary. And Dr. Martin seconds that. Any further discussion? Hearing none, all in favor? Any opposed? Any abstaining? Motion carries. There were no motions necessary on any of the other items that were discussed in closed session. Agenda item number 4 is to confirm the next regular board meeting time, date, and location. Managers, our next Central Health Board of Managers meeting is tentatively scheduled for Wednesday, December 13th, 2023 at 4 p.m. at Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas, 78702. At this time, I'm ready to accept a motion for adjournment. Dr.
Someone has seconded it.
Okay. Manager Jones motions for adjournment. Dr. Zamora seconds it. Any further discussion? Hearing none, all in favor?
Aye.
Any opposed? We are adjourned. Thank you, members.
Thank you, Chair Bell.